This is Gina from RN2 Professors with a video for you from my OB series on review questions for hemorrhagic disorders in late pregnancy. In this video, I am going to review questions on hemorrhagic disorders in late pregnancy. I will show you how to determine what the question is asking and how to get the correct answer. Let's look at the first question. A pregnant client is admitted with a diagnosis of third trimester bleeding. It is priority for the nurse to assess for a change in which of the following vital signs? 1. Temperature. 2. Pulse. 3. Respirations. Or 4. Blood pressure. This is an analysis question. The question is in the assessment phase of the nursing process and is asking what will be priority vital sign data related to a patient with third trimester bleeding. Number 1. Temperature. This is not a priority in this situation. Number 2. Pulse. There would be an increase in pulse rate with blood loss. This does look like it is our answer, but let's make sure. Number 3. Respirations. This is not priority in this situation. Number 4. Blood pressure. Since this is the third trimester, blood pressure can be maintained for a long period of time. This is due to the fact that by the second trimester, the patient has doubled their blood volume. A change in blood pressure is a very late and ominous sign. Number 2, pulse is our answer. It is the priority assessment the nurse should be looking for. Next question. A pregnant client, G6, P5005, 24 weeks gestation, has been admitted to the hospital for placenta previa. Which of the following is an appropriate long-term goal for this client? 1. The client will state an understanding of need for complete bed rest. 2. The client will have a reactive non-stress test on day 2 of hospitalization. 3. The client will be symptom-free until at least 37 weeks gestation. 4. The client will have normal vital signs. This question is asking you to find the appropriate long-term goal for a 24-week patient with placenta previa. You need to apply your knowledge of interventions for placenta previa and the needs of a 24-week gestation client to determine the best long-term goal. Number 1. The client will state an understanding of need for complete bed rest. This is a common intervention for women with placenta previa. However, this is considered a short-term goal. Number 2. The client will have a reactive non-stress test on day 2 of hospitalization. Stress tests will be done for these patients. However, this again is a short-term goal. Number 3. The client will be symptom-free until at least 37 weeks of gestation. Being symptom-free till 37 weeks is an appropriate long-term goal for this patient. This looks like our answer, but let's read through our last one to make sure. Number 4. The client will have normal vital signs. Again, this is a short-term goal. Number 3 is our answer. It is the appropriate long-term goal for this patient. Next question. Which of the following statements is appropriate for the nurse to say to a patient with a complete placenta previa? Number 1. During the first phase of labor, you will do slow chest breathing. Number 2. You should ambulate in the halls at least 2 times each day. Number 3. The doctor will deliver you once you reach 25 weeks gestation. Number 4. It is important that you inform me if you become constipated. This is an application question. The key here is the patient has complete placenta previa. You need to know what are appropriate interventions for complete placenta previa to answer this question correctly. Number 1. During the first phase of labor, you will do slow chest breathing. Patients with complete placenta previa are not able to have vaginal deliveries and will have cesarean sections. This is not the correct statement for a patient with complete placental previa. Number 2. You should ambulate in the halls at least 2 times each day. This is an inappropriate statement for this patient. Patients with complete placenta previa are usually placed on bed rest with bathroom privileges only. Excessive ambulation is discouraged. Number 3. The doctor will deliver you once you reach 25 weeks gestation. 25 weeks would be very preterm. They would try to maintain the pregnancy as long as possible, ideally to 37 weeks. Number 4. It is important that you inform me if you become constipated. This is an appropriate statement for this patient. Straining can cause pressure that would result in placental bleeding. Number 4 is our answer. It is the only statement appropriate for this patient with complete placental previa. Next question. A client, 32 weeks gestation with placental previa, is put on total bed rest. The physician expects her to be hospitalized on bed rest until her cesarean section, which is scheduled for 38 weeks gestation. To prevent complications while in the hospital, the nurse should do which of the following? Select all that apply. This is an application question. Even though this is an OB question, it is mainly about immobility. You need to have an understanding of what interventions a nurse would do for a pregnant patient on bed rest. Since this is a select all that applies question, make sure to look at each answer individually to determine if it fits the question. Number 1. Perform passive range of motion exercises. This is something that the nurse would do with the patient. Immobility can cause muscle atrophy. Doing passive range of motion exercises will help decrease that risk. Number 2. Restrict the fluid intake of the client. This is not something we would do with a patient on bed rest. The patient needs to be hydrated to maintain healthy bowel and bladder function, so this is not an appropriate intervention. Number 3. Decorate the room with pictures of the family. Patients can get depressed being separated from their family. Pictures in the room and frequent visits are a good way to reduce depression for the patient. Number 4. Encourage the client to eat a high-fiber diet. This is something that we would do with the patient. Immobility can slow down bowel functions. Eating a high-fiber diet is one way to help maintain healthy bowel functions. Number 5. Teach the client deep breathing exercises. Deep breathing exercises should be taught to maintain respiratory function and prevent atelectasis, which is another risk of immobility. Number 1, 3, 4, and 5 are the correct answers. They are appropriate interventions to prevent complications from bed rest and immobility for this patient. Final question. A nurse notifies the healthcare provider that a patient has been admitted to the high-risk unit in her 36th week of gestation. She is bleeding, has severe abdominal pain and a rigid fundus, and is demonstrating signs of shock. For what intervention should the nurse prepare? 1. A high forceps birth. 2. An immediate cesarean birth. 3. The insertion of an internal fetal monitor. Or 4. The administration of oxytocin infusion. This is an application question. You need to know what diagnosis the signs and symptoms are showing and what the correct priority intervention is for that diagnosis. The signs and symptoms here are describing placental abruption. What is the intervention to prevent fetal and/or maternal death? Number 1. A high forceps birth. This procedure is not appropriate. It could further complicate this situation by tearing the cervix. Number 2. An immediate cesarean birth. Delivering the fetus is a priority before it loses oxygen and the mother goes into hypovolemic shock. This looks like our answer, but let's check all of them to make sure it is the priority. Number 3. The insertion of an internal fetal monitor. This is not an appropriate intervention at this time, and the delay to deliver could cause fetal death. Number 4. The administration of oxytocin infusion. Oxytocin would not be given at this time. This is not the priority intervention. Number 2 is our answer. Delivering the fetus is the priority intervention and treatment for this situation. I hope this video helped you. If you liked it and want to see more videos, subscribe for free and click on the bell to get notifications when new videos come out. Thank you for joining me.